Welcome to the Exam Room with your host, Dr. Rhiannon Winsor. In this podcast, we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. In this wrap-up episode of the Exam Room, Drs. Winsor, Melk, and Siri reflect on the shift from task-based care to outcome-driven strategies. They emphasize the importance of collaboration, shared learning, and focusing on one actionable area to drive quality improvement. Health centers are encouraged to attend network meetings, share best practices, and identify small, achievable goals to create meaningful change. The conversation highlights the value of peer support across health centers, the impact of knowing your community, and the role of primary care in transforming lives through access and prevention. As value-based care expands nationally, especially in rural communities, the episode closes with a renewed commitment to innovation, equity, and the mission of health for all.
So as we are kind of wrapping up and we're talking about this shift from kind of this task-oriented approach to a patient outcome approach, is there any advice that you ladies would give regarding, health centers that are struggling to make this shift, or maybe barriers? What can they do?
Yeah, I think from my side, I would definitely say come to these meetings, because this is where you tell us what challenges you're facing, because this year the modus operandi for these meetings have changed. I want these people to come to these meetings and let us know if they're doing well, how they are doing it, and if they are not, and what are the challenges they are facing, so that I can bring it to the board and we can tell them that these are the challenges and these are the things that they think can help them. So how can we help all these FQHCs? So that's why I want to make sure that there is attendance to this meeting and we discuss those. It is not just me presenting this here saying this is what you need to do, this is what you need to do. I'm here to ask you questions, just what is it that is stopping you from achieving these goals, and how we can help it as a whole network.
Right. And I think that's good advice for any health center that is part of any ACO, right? To say, use them, partner with them.
One thing that is very important for everyone to understand is one FQHC doing well is not going to help. We are all a network. So all the patients are all the part of this network. So we cannot be seeing Chirikwa as separate from Sun Life, separate from Sunset, and so on and so forth. All the patients are falling under this network, so it has to be a collective approach to achieve success.
As we do with anything, try to maybe pick one or two things that you really feel like, or areas or quality gaps that, like I mentioned, the Medicare annual wellness visits was something that we decided to focus in on, where you feel like your health center maybe is struggling. And then, I think reaching out, and this is what I love about working in the FQHC environment, I think we're all in this together, like even as a nationwide kind of network, that we are serving patients that are facing difficult circumstances, because we are able to see any patient regardless of ability to pay. And so we have to be creative and we lean on each other. And I have only felt that, like I can call a colleague, even if they're not in, the ACO, but to ask them, how did you master this? Because it seems like you're doing really well. Can you share that job description? Can you share the procedure? Can you share? And we share. I just emailed a chief medical officer from a health center yesterday with one of our procedures. So I have only felt like our environment and our culture is to be of that mindset to share. And so I would say choose one area that you feel like, your health center is struggling, and then you can, hopefully learn some details on how they, concrete steps that you could take to implement, because, I think collectively we want to do the same good work for all of our patients. And so that's what I would say.
Sharing the best practices, I think that's the key, because again, like I said, if one FQHC is performing better, then we are there in these meetings to listen to them and see what they are doing different from the one who's not doing it well. And if they can follow on the same footsteps, if they have the manpower to do so, then yes, they should.
Yeah, and let's not reinvent the wheel if we don't have to.
Exactly.
I mean, if something works for somebody else and it might work for us, like we share and everybody wins. The patient wins, which is the most important thing for sure. As far as anyone who's listening, and I think maybe this is kind of somewhere in there already, but they're thinking, yeah, this is really great. Like, yeah, you've given some great advice, but I don't even know where to begin. So as far as a first step, would it be just identifying that one thing, or is there any other...
For the patient?
For the health center?
Yeah, like, Dr. Melk was saying, just hone in on one thing. Don't try to change everything at once because that's too hard. Any other first steps as far as just shifting from task orientation to patient outcomes?
No, I would say look at your numbers, look at the MSSP measures and see which is the one that you feel the least confident about, and try to develop strategies around how to approach it. Mm-hmm. If you think it's your depression screening, because that's the one that I heard from one of the FQHCs last time, that, that is a big target, but do you know which patients you can screen? And if you have that first question answered, then go to the next question. That is how I would like to them to approach it. Mm-hmm. And then if you get stuck at one question, that is where you approach us and see how we can help, and it might be very simple solution that you haven't even thought about. So that's what I would like them to think like.
And I think any health center that's partnered with an ACO, like, they might not know the questions to ask, like in the past I've had students say, well, I don't know what I don't know. Well, and then that's where, you guys can come in to kind of ask the questions, to peel back the layers, to then guide them better, right? Yeah.
I guess I would say just to remember sort of why FQHCs exist. They were established, just because there were individuals in our country that couldn't access primary care. Just to kind of put some numbers to it, we actually serve just last year in our UDS data, just over 35,000 patients, which, I mean, relative to some, massive health centers, it's not too large, but it is almost a third of the county that we serve. So it's very likely that the patients or the people that I'm interacting with in the school, or, from where my son goes to school, or in the grocery market, they probably come to Chiricahua. And so, yeah, it's a little different when that what our system is doing could potentially be saving that person's life. And sometimes I hear that, I'll hear oh, I'm so glad Chiricahua's there. I didn't have any insurance. I couldn't pay for my medicine. And because of our pharmacy program, the 340B pharmacy program, and the discounts that we're able to offer for uninsured patients, it literally, she says, saved her life, And so that just thrills me to no end, to just know that we're there and that we can, open door policy, anybody can come in and we can serve you. Can I do surgery on? No, we can't, but we'll do what we can, even using Chiricahua Cares or, whatever it is. So yeah, no, we definitely are passionate about that. And our vision statement kind of says it, health for all in caps. And we truly believe that all individuals deserve access to high quality primary care. What we can do as far as primary prevention is huge. It benefits our society, it benefits the individual patient, and really is a great feeling as primary care providers to be able to provide this higher level of care. And so although, we do have to, see a lot of patients and still kind of have that volume in the back of our minds, if we can implement, strategies to leverage our team and to really kind of have quality be part of that conversation, I think it's possible. And it actually is, to me, the more gratifying part of medicine is feeling like we've saved lives, because I know we do when we focus on it. I'm hopeful that we can continue doing everything that we've been doing, and we're getting ready to pivot. I know there's a lot of change in the air, but we want to maintain our mission and do whatever we can. If we have to be, innovative, we will be, to continue to serve everybody. So,
thank you for everything that you're doing.
Thank you.
Dr. Siri, any final thoughts?
I would just like to say the same thing. Value-based care. Think about value-based care becoming more important. FQHCs have recently started to get into value-based care over the last few years. It was mostly, urban-based clinic or suburban areas, but now it is, these rural areas that are being looked at by CMS to be involved into value-based care, because they are talking about every Medicare patient to be a part of value-based care by 2030. And that is why FQHCs are playing a huge role, because there are a lot of patients that are being catered to at these FQHCs, and that is why it was a great idea for all these networks coming in and asking FQHCs to be a part of the ACOs, and trying to see how we can incorporate value-based care for the sickest of the sick patients.
Absolutely. Thank you both so much for sharing your thoughts today and for everything that you're doing.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.